Good morning, colleagues who are joining. It's 9 o'clock. Welcome, those who are joining. We're going to give it a couple of more minutes for colleagues to log on.
Morning, Sanhita.
Morning, Jonathan. Tara, we will discuss all of the, yes, so Josie's answered that. All the slides will be available. Thank you. Okay.
Hello, everybody.
Good morning, everybody. We'd give it a couple of more minutes for colleagues to join. Josie, can you keep an eye on the colleagues joining, because we've had some of our colleagues register with you, isn't it? Just make sure they're all joined.
Hi, Sunita. Yeah, I'll keep an eye on everyone joining and make an attendee list at the end.
Perfect. Thanks, Josie.
Okay.
I'll give it a couple of more minutes. I think people are still joining. Okay, it's 2 minutes past 9. Good morning, everybody. We will begin our educational event today, which is talking about our children, young people's pathways, and all the work that's happening across the system to make sure our children get the right support at the right time, at the right place. So welcome, everybody, and a big thank you to Josephine Clark from our CCG Comms team for helping us organize this educational event, and a big thank you to all our paediatricians, general practitioner colleagues, community colleagues, 111 colleagues who are also joining us today to talk about all the existing pathways. Thank you very much all for joining. It's a Saturday morning, so I'm sure you've all taken time off to do this webinar. Couple of things, just as an introduction, I'm Sunita Chakrabarti. I'm clinical lead for children, young people and maternity for Bedfordshire, Luton, Milton Keynes, ICS. A couple of things to remember during the educational event today. The event will be recorded, and the event will be the recording and the questions asked and the slides and pathways will all be on our website. And Josie has put the website address on the chat box. So please relax, listen, and hopefully you should be able to get all of the outputs of today's webinar. A couple of things. Please, can you all turn your cameras and your microphone off? We will not be taking live questions. Any questions can you kindly put onto the chat box, and presenters will answer your questions on the chat box. And all questions answered and all questions asked will be compiled into a frequently asked questions document, which will also go onto our website. Please also refrain from taking control of the slides. There is a lot to get on to today, so there's quite a tight schedule we've had to keep. So please do not take control over the slides. We're going to have a break after the first hour, and that is the planned break. However, in between, if you want to go away and get a cup of tea and have comfort breaks, please do that. Do have us on the background, and we will keep continuing with the presentations. We've got an evaluation form, and Josephine Clark will put that on the chat box. Once you complete and send the evaluation form to the comms email inbox, which will also be on the chat box, you will also get your personal copy of all of the pathways and the presentations. So please, this evaluation is going to be very important for us to organize future events and also to hear from you what else would be helpful for colleagues working out there. Okay, thank you again for everybody joining. So without much ado then, may I open up the event and invite our first speaker, Barbara Moran, who's going to talk to us about the NHS 111 service and the pathways. Over to you, Barbara.
Thanks, Anita. Morning, everyone. So for those of you who don't know me, I'm Barbara Moran. I'm one of the urgent care commissioners for the CCG. I thought this morning it might be helpful to give you a quick overview of the 111 telephony service and also the online pathways. As Anita said, if you've got any questions, just drop them into the chat and I'll answer them once I've finished my presentation. So starting with the telephony service, we currently have our local providers who are HUC and DHU. So HUC are serving Bedfordshire and Luton, DHU cover Milton Keynes patch. As part of the COVID response and now looking at a possible second wave, we also have some previously established national services that are currently being stood back up. So this means when a patient is calling 111, before they get through to our local service, they will be asked if their call is relating to COVID-19 and asked to press option 1 or 2 if their call is relating to COVID-19. If a patient follows that option, their call is likely to be answered by the National Call Handling Service, which is called CRS, COVID Response Service. Linked to the COVID Response Service, we also have the National COVID Clinical Assessment Service, which is the CCAS, which is the clinical support for the COVID-related calls. So already you can see we've got a couple pathways, one taking patients into the national service and the other bringing them back into our local service. Locally, as part of the 111 service, we also have a clinical advisory service that support that. So I'm just going to talk you through what happens when a patient comes through to our local service. So our call handlers use something called NHS Pathways, which is their clinical decision support tool. And the call handlers have to work through a series of questions with that patient or their parent, carer, guardian, if they're phoning in relation to a child. And following those questions, they will arrive at a disposition. And it's the disposition that dictates what happens next to that patient. So that could be further clinical input. They could be referred to another service, such as a GP. They could be advised to attend ED, or they might be called an ambulance if that was appropriate. As I mentioned, locally, we also have clinical support on the telephony service. So this is both what we call clinical advisors, which are mainly nurses and who would take, for example, some lower acuity calls that may need that home management support. But we also have the clinical assessment service, which is GP-led, but also supported by other clinicians such as ANPs, pharmacists, paramedics and dental nurses. We have a system in place whereby most of the category 3 and 4 ambulance disposition calls and the ED disposition calls will go through to the clinical advisory service for further clinical assessment before it's sent back out anywhere else. That's a very quick overview of how the telephony system works. Josie, if you can move on to my next slide, please. So what we've done, sorry, Josie, there's someone waiting in the lobby. Could you just admit so that I can see the slide? Because it's up on. That might be my slide. Sorry. Okay, I'll carry on. I'm hoping everyone can see the slide. Please drop in the chat if you can't. So what I've done is I've picked out 4 scenarios so you can see what happens at the 111 call handler stage. So you can see here on this slide, this is a scenario for a child with a cough and a fever. And you'll see here the call handler is working through trying to rule out any life-threatening conditions whereby the patient would need to go to ED or be called an ambulance. Now, this patient, they did have a fever, and the disposition that was reached was speak to clinician from our from the 111 service for home management. So this is most likely to fall into our CA pool, so that's a clinical advisor pool, as I referenced earlier, and they will give the patient advice to manage their condition at home. Obviously, what we're also doing at the moment, for any patient that has one of the COVID symptoms, they will also be advised on how to get a test. And as I'm sure you're all aware, 111 are unable to arrange tests. That needs to go through 119 or the online service. So that's our first one. Josie, can you move on to the next one? So this next one shows a child with, sorry, 2 seconds. With fever and breathlessness. And again, you can see the call handler there working through ruling out life-threatening conditions. Now, this patient needed to contact a service within 6 hours. That's a primary care service. So this is where we now see the distribution of that patient to different services depending on the time of day. So in hours, this patient would be referred to their own GP. If the GP practice has directly bookable appointments set up and available, then this patient would have been booked in using that method. Otherwise, the patient would be advised to contact their GP practice. Out of hours, it would go into our out of hours triage pool and then potentially booked a face-to-face appointment if appropriate. So that's that one. If we move on to the next one, Josie. So this one is a child with cough and breathlessness. And you can see here at the top, the disposition is to speak to the clinical assessment service within 1 hour. So this would be put through to our GP-led CAS, and they would then assess the child to see whether they needed to go to ED, for example, or an ambulance. Once it comes through to the clinical assessment service, the GP has the same options available to them as our call handlers, and in some cases a few more services that they can directly book into. But after this phone conversation, they may have been also offered a visit video consultation, and then they may be sent into the out of hours pool or onwards to ED. So the next one, please, Josie. So we thought we'd show you one of our options where the Children's Rapid Response Service returns. So this is a child with a cough and breathlessness. They get a disposition that could be directly booked into our Children's Rapid Response Services. So that will be booked in to that service. The patient's information will be transferred with that booking, and then our Children's Rapid Response Services can phone the patient and, if need be, arrange a face-to-face appointment. So that's everything with the telephony. I'm just going to spend 1 minute just going over the online service. So the online service works very similarly to the telephony service, except the patient obviously needs to work through the questions themselves. Throughout the assessment, there are help boxes to provide the patient with clarification or definition of what the question is asking them. The online service is controlled nationally, so we don't have so much input into where patients go. Locally, though, we do have a callback option for every patient that is given an ED disposition or a category 3 and 4 ambulance disposition online, but they can choose this, or they can choose to say no and then go to the ED directly. Once the patient gets a disposition, so if it's a primary care disposition, they'll be advised what to do, so to call their own practice, for example. So that's a very brief overview of the 111 pathways. I'll stay on the chat for 10 minutes and just answer any questions that you've got. Thank you.
Thank you, Barbara. That was really, really comprehensive. And please put your questions on the chat box for Barbara to answer. The pathways that Barbara described are what 111 will resort to. Later in the webinar, we'll hear about our COVID-19 pathways from Lynn Fanning. Okay, we move swiftly on to Shankari. Shankari will introduce herself and we'll talk about sort of the system in Milton Keynes, and we'll also talk about the Arden's templates and where to find pathways in the system one if you're looking for them. Over to you, Shankari.
Hello, my name is Shankari Maha. I'm a GP in Milton Keynes, and I'm also the clinical lead for the Children's Commissioning Board across Milton Keynes. There is a question at the top there, and I don't know if Barbara is able to answer it from Vishali, and I can see what she means. In day-to-day life, it is hard for us when we get the reports from 111 to realistically look through all the questions that have been answered to find the ones that are positive. But let's see. So essentially today I'll start off by talking about the fact that, as Sunita said, we have, as a paediatric reference group, worked on producing pathways to help our primary care clinicians navigate through the system and make sure that our children, some of the most vulnerable people that we look after in general practice, get to the right place to see the right clinician, especially during this COVID period. Now, with that in mind, we wanted to advocate the use of the current Arden templates that we all have as part of System 1 across BLMK. So, Josephine, if I can ask you to go to the first slide. Essentially, I'm just going to try and highlight that if we all try and use the technology that's available, hopefully we can make our own lives a little bit easier. So with Arden, that big C, red C in the patient's detail corner in the right top hand corner there in System 1 will allow you to open up their template. Next slide, please, Josephine. I want to go through these quite quickly. So on here, as you can see, the home slide, the home sort of template it brings up is usually aimed at adults, but at the bottom of that, I hope you can see a small red telephone symbol. When you click on that, it's a pediatric remote assessment tool. Josephine, can we go on to the next slide, please? And this will bring up various categories and tabs at the top. The first one being fever in a child under the age of 1. Josephine, if we can go on to the next slide, please. And on that, you'll see it's RAG rated following the NICE guidance. And these templates are national, so unfortunately, we're not able to change them. And I suppose we wouldn't want to, because the category in which we assess or put our children is the same nationally. And the next slide will show just another example of children over the age of 1 if they were to have a fever. But the next slide is, I think this is hopefully the bit that's more interesting to everyone. So the up-to-date templates or guidelines and pathways that we're producing about how to navigate the patients through to the right place. Obviously, that varies between Milton Keynes, Luton and CCG. And today, 3 of us working as GPs in each of those areas will talk to you about how we're navigating children in our specific locations. But if you just want to find the pathway that you should or would like to use for any acute or common presentation in general practice for children, so whether that's acute abdominal pain, vomiting, bronchiolitis, breathlessness, a fever, whatever it might be, if you click on that yellow arrow, again in the in the patient's detail corner on the right top hand corner of your screen, then it will take you through to Josephine. Could we go on to the next slide, please? Josephine?
that not change? Oh, it changed.
Yeah, there we go. No, it just took a
sorry.
second, I guess. No, don't worry, it's not your fault. Maybe my internet's slow. So it takes you through to this page called Communications. And now, depending on where you're logged in on System 1, so for mine is Milton Keynes, it will come up with this where it says Communications Milton Keynes. And the next few slides will show you the same, essentially the same, but for Luton or Bedford. And when you click on that, for the next slide, please, there's a guidance and comms section there. And when you click on that, all these folders will appear. And during this COVID period, most of the pathways that you'll be looking at will be in the COVID-19 box. But if not, by default, most other pathways will end up in the pathway box that you can see there. And when you click on that, it takes you onto the website and actually opens up the up-to-date pathways that we will be reviewing, and we've already reviewed throughout this COVID period, and will ensure that they're accessible to you. So when you have that patient in front of you, you can just click on that, see the pathway, follow it through. Hopefully it's nice and simple and not too many steps to go through. It will tell you about some of the treatments we would advise in the meantime, how to review, or what kind of timeline to review at, and if not, if you were to refer, who your sort of next point of call would be, depending on where you're based. So the next few slides, I believe, are just on that. So this is for the Bedfordshire and then the Luton, and it's the same at the bottom. I'm sorry, my house alarm has just gone off downstairs. I'm gonna have to go and check on that. Could someone else do? I will certainly come and talk about how we refer within Milton Keynes in a minute, but could I ask maybe the next speaker to go ahead and speak about their location? I will come back. I've got to go check where the alarm's going off.
Okay. Deo, do you want to go next and talk about our Bedfordshire system then, Deo? Over to you, Deo.
Good morning, everyone. Thank you for taking time out of your weekend to attend this session, and I hope you go away gaining some new information. I'm just going to talk about accessing primary care services and extended access in Bedfordshire. It says Bedfordshire, but I would like to emphasize that it's mainly in Bedford, which is the north of Bedford. So Bedford have facilitated for the PCNs of Bedford Red Zone to see patients with potential COVID symptoms. These patients contact their practice or 111 and have an initial telephone triage. If the outcome shows that they need a face-to-face consultation, but have symptoms of potential COVID, and we know these are a fever, loss of taste or smell, or continuous cough, or people who are sharing a house with someone known to have coronavirus or are developing symptoms, who need urgent face-to-face appointments. They are booked into the red zone. So I would like to emphasize that these patients are booked by 111 or their practice into the red zone. Once they're booked into the red zone, the patients get another telephone call from BEDOC to find out, just to clarify the symptoms and to make sure that the booking is appropriate. If the booking is appropriate, they're then booked into a face-to-face appointment slot on the day at the red zone. Then I guess one or two will be asking what happens to the other areas of Bedfordshire, which is central Bedfordshire. In central Bedfordshire, it's done differently. Different practices do it differently. So in the initial phase of lockdown, PCNs came together and they divided themselves into cold sites and hot sites. So some surgeries were designated hot sites and some cold sites. But once the lockdown was lifted and the coronavirus pandemic level was reduced, surgeries now, most surgeries actually operate a cold and a hot site within their practice. Any questions?
Thank you, Dale. That was really helpful. Please kindly continue to post your questions on the chat box. So I think Shankari's back. Shankari, do you want to take us through the Milton Keynes system? And also, Shankari, there's a question on the chat box about the EMIS. Okay, so over to you, Shankari.
I'm really sorry about that. I'm not sure what set it off, but I'm back. So just to answer the question about EMIS, so across Bedfordshire, Luton, Milton Keynes, System 1 is the most dominantly used, and I thought it was the only system that we used across BLMK. So unfortunately, Arden templates has only been commissioned on System 1, I believe. So I really don't know what the answer is for EMIS. But if you could maybe email us with your practice that you're at, and if you're using EMIS across within BLMK, we can certainly find out that detail for you. And certainly our pathways are all made available through the GP bulletin, which you would get if you're registered as a GP across BLMK. Now to come back to the technology we use, I'm just going to talk a little bit more about AccuRx as well, just to remind clinicians. I know when clinics are running busy, none of us want to convert to video consultations if we're confident with our telephone assessment. But I would urge that, especially with children, that we try and remember that actually just that sort of end of bed sort of eyeballing, I call it, just a quick, if you're taking a history from a parent, I think it comes down to how well that parent is able to articulate their concerns or what they've picked up from their child in terms of how they're presenting in an unwell way, and also the anxiety levels within the household. And I think right now with COVID, of course, those can run quite high because of the impact having a sick child at home has on everyone's life in that house. I think it's sometimes I find very often if I just do a quick glance at the child, and even though from what the parent have described, you might be thinking, are they amber? Do they need to come in for a face-to-face assessment? Actually, just having a quick look at a child that's clearly running around, doing their thing, then you know that they're probably going to be okay, and you could possibly arrange for a follow-up over the phone again in 48 hours or so if required. So I'd certainly urge people to use the functions on AccuRx. So the video, I think that most of us are accustomed to, but also there is a automated COVID patient questionnaire that you can send out to patients. So if someone presents with COVID or potential COVID symptoms, or if you're thinking of reviewing a patient for something non-urgent, so you've booked them in, whether it's for your nursing team to do a smear test, there is an automated AccuRx questionnaire that you or any of your admin staff can send out for patients to fill out and sort of prompt them to check themselves for COVID symptoms and cancel appointments if it's appropriate to do so, if they do have any of those symptoms. And also a follow-up questionnaire. So if someone presented to you with being slightly breathless and has a bit of a temperature, but you feel that they're safe enough to stay at home, you could set it up on AccuRx to send in a daily or every 48 hours for the patient to do a questionnaire on how they're feeling, how their symptoms are now. And obviously, depending on the clinicians on site and how many people are able to check that inbox and that data coming back, is certainly it saved us quite a lot of phone calls by letting the patient fill out those questionnaires and only having to follow up patients where some alarm bells are ringing. Watford, sorry, I just saw the answer there. Now, in terms of what's happening in Milton Keynes, we're really lucky, and yesterday we've just had the funding come through for the HOT Hub for both adults and children, which is currently based at the Urgent Care Centre, our walk-in centre. And for the children, we're lucky to have our matron Beth Koshlin's team, the children primary care team, who see all of our sort of red or potentially COVID symptoms, patients with any potential COVID symptoms. There's a question there about, are we at risk of flooding the red site? And I can see that was aimed more at Bedford, but I guess the aim of all these pathways that we're talking about today is to try and contain what we can in primary care. Obviously, we're going to feel the strain across the board this winter, and I think we're all anticipating that, but we're hoping that as long as we all have a clear way of, okay, which children actually need to be seen face to face, and hopefully by doing our telephone and video consulting, we can try and reduce the numbers of those. In Milton Keynes, currently, we're not seeing any children with any fever in our own practices, so none of us have had to create hot zones yet. But I suspect, obviously, we have to be adaptable over the winter period if required, especially if the system is flooded. But for now, we're lucky to have Beth's team, and she will come on in a minute to let us know about how her team works. But essentially, you call the number for the urgent care centre, which is 01908 30 30 30, press option 4 and refer the child on that way. Lovely. I'll leave it as that. I'll pass it on to Hetto, I believe, who'll be covering the pathways within Luton. So yeah, Beth, great. Yeah, put the great news out there. So we've got the hot hub secured now till March, which is great. So that's all good. I'll watch out for questions.
Yeah, thank you, Shankari. Again, please continue to put your questions on the chat box, and thank you for all of the questions that are coming in. The more the questions, the merrier. So our presenters are going to continue to answer them. Can I request Hetto to come and talk about the Luton system? And I think there's a question already on the chat box about Luton. I think Hetto will cover that. Over to you, Hetto.
Hi, thank you, Sunita. Thank you, Shankari and Deo, who've made my job a little bit easier, covering quite a few bits, which are similar, but of course there are some variations. So yes, my name's Hetto and I'm a GP in Luton, and also the CCG Director and Clinical Director for Eden PCN in Luton. I'll keep this brief, but in terms of the provision for children and young persons in Luton, there is similarities and there's variations. So just going to my first slide, in ours, general practice is offering a mixture of telephone consultations and triage, and then these based on the consult can lead to video consultations or a face-to-face when needed. Telephone appointments are traditionally booked by practice reception staff with the most suitable clinician. With the advent of PCNs, the workforce is a bit more diverse now, so telephone appointments, for example, in our practice can be booked with a variety of colleagues, which include clinical experienced nurses, paramedics, PAs, GPs and trainees as well. In Luton, we have had the process where 111 have allocated slots within our rotas. So, for example, in our practice, we have 52 directly bookable slots for 111 on a daily basis. So, so that's how it's kind of working in general practice in the majority of cases. And again, face-to-face appointments are really dependent on individual practice capacity following the actual triage process. We have to be kind of mindful that not all practices are able to offer the same amount of face-to-face consultations as prior to COVID. Coming to Asima's question, the Luton COVID Assessment Centre was decommissioned in July, and as I understand, there is no current funding which is going to be allocated for any development of a new hub. So this leads to where capacity and access is a question, where if some practices have their own designated red zones or red rooms, etc., where they can see patients who may have COVID or suspected COVID-like symptoms. But in a lot of cases, practices will not have this set up due to purely space and estate reasons. So in this case, those patients will be within working day hours, may be referred to rapid response, or if there is a significant clinical need, they will be referred to PAU, or they will be advised to attend A&E. So if there's any questions on this slide, please do type in the box. I will try and answer once I finish the presentation. Josephine, could we move on to the next slide, please? So out of hours, the patients can, 111 can directly book patients into extended access surgeries, into the urgent GP clinic, and also the walk-in centre. GP practices can also directly book into extended access surgeries. However, extended access will not accept face-to-face consults with patients who have symptoms of or symptoms suggestive of COVID. And this is purely on a reason, as I understand, due to inadequate provisions for PPE. And then this leads to the other place where children may be seen out of hours is A&E. So as I understand, A&E have a triage system at Luton where they may see the child themselves if they have the capacity or if they meet their clinical criteria, or they may be referred to urgent GP or PAU. So this is kind of in a nutshell about what is happening in Luton at the moment. As I said, in July, the COVID assessment hub was decommissioned, but this was actually just for adults. And during the height of the pandemic, the rapid response team were excellent in taking any referrals from us. This was via telephone, and then kind of a referral was provided on ICE for them to have as a basis. Can I just go on to the last slide? This is just something I kind of looked into as a purely kind of a learning exercise for me. And I always believe that pathways follow a good process. So during in our practice, I think our practice is quite special, and I'm very lucky to be part of it. But we've been using telephone triage and consultation since 2016. So during the COVID pandemic, it was quite easily to mobilise to all triage and offer face-to-face when needed, and we continued doing that within our practice throughout the whole of COVID. So you can see that, you know, we're a system where triage was already kind of in process. The patients still had good access. So between March and September, we've had 8,110 paediatric consultations, which I think is quite, you know, impressive, and just shows you that, you know, if practices have good setup where patients understand the process and who they will be seeing, you can actually accommodate a lot of access for the patients, and then just bring in what is necessary. So on that note, I will finish, and I will stop there. Thank you.
Thank you, Hettel. That was really comprehensive, and I think there's some questions on the chat box for the Luton system. So if you could kindly answer, that would be great. Moving on. And I think there's questions around can we refer to rapid response, and that's what Lynn's going to tell us next. Thank you very much, Lynn, to take us through the Children's Rapid Response Service, which we now have for the North and South. So over to you, Lynn.
Yeah, thank you very much. My name's Liv Fanning. I'm the team lead for the Children's Rapid Response team in Luton and the whole of Bedfordshire now. And I can see there was a few questions about the Rapid Response Service, so hopefully I'll cover that in the next few slides. Next slide, please, Josie. So it was set up in 2013, and initially it was just Luton only, but I'll come on to that. It's now we're now throughout the whole of Bedfordshire. We're Band 7 children's community nurse practitioners, and all of us have the V300 non-medical prescribing qualification. Our hours of working are 8 till 6, 7 days a week, and that includes bank holidays. And we're a clinic-based model. So we are we do see children. If we see children face to face, we see them in a clinic, either at Luton Treatment Centre in Luton or the Child Development Centre in Kempston. Next slide, please, Josie. So there was been some various phases. We started off very small team. 13 when there was just 2 of us, and I only took referrals then from the hospital and the walk-in centre as it was then. The following year in 2014 we were able to increase to 4 nurse practitioners, and we could extend referrals to Luton GPs. Next slide please, Josie. And then in 2018 we moved from a home-based visiting model to a clinic model, and we started to get referrals from 111. Then in 2019, so last year, we increased the amount of nurses in the team, and we were able to extend the service to South Bedfordshire patients. And then in February of this year, we moved to complete clinics-based model 7 days a week, including bank holidays. So that was weekends as well. Next slide, please. Next slide, Josie. And it due to when, oh, sorry, one before, Josie, please. Oh, can you go back a slide, please, Josie? Yeah, sorry. Oh no, next slide. I think there's a bit of a time delay. Thank you. So due to COVID this year, things have progressed very quickly. And then in April this year, we increased our age range to 16 for the 111 referrals. Previously, they were just 0 to 5-year-olds. And we extended our service to Mid and North Bedfordshire patients for 111 referrals. Increased the capacity of the team again. And then in June, we set up a second clinic in Kempston. And the 111 referrals were